Hi, this is Dr. Ivan. I wanted to go through a little stretching routine that I put together for our patients and friends that want to initiate their day with a little bit of added mobility. Very simple. Let's just get started. Try to do a wide stance and just support yourself. Go ahead and support yourself and use your arms to just assist your lower back in coming down. Now, I've got my back arched backwards, but now I'm going to relax it and flex forward. And you can hold on to your lower legs as you come down a little at a time. It's good to support yourself and take a deep breath in. Come up so that you give the diaphragm some room, and then exhale. And perhaps go a little lower. Come up again. And fold forward. Maybe support yourself on the floor, or if you can only go to your lower shins, that's fine. Remember, this is all about you. There's no right, there's no wrong, just nice and easy stretching. Take a deep breath in and come up. We're going to go over to the side. If you can, close your eyes a little bit. Use your brain's cerebellum to assist with balance. This is something that's super important as we get older. And we lose confidence sometimes as we get older with our balance, and it's good to train our balance. Nice and easy stretching. And breathing from your diaphragm. When you breathe from your diaphragm, your belly will come out. That's natural. I'm going to switch one more time. Engage your core, your glutes, your hamstrings, your quads, the entire leg, the entire pelvis. Tighten it up. Feel that stretch. Deep breath in. And another forward fold. Now you can do this with a wide stance, or if you'd prefer, do a close stance. Let's go ahead and turn to the side and do a downward dog. You notice that I'm holding onto my shins. I'm doing a nice, easy stretch. And just go ahead and spread out those hands and get a good stretch of the fingers. And I'm doing one leg at a time to just stretch out the Achilles tendon and the plantar fascia. You know, plantar fasciitis is something that irritates many people, and sometimes it comes and goes. And it's truly a product of tight feet and Achilles tendon and the calf muscles, the soleus and the gastrocs. And if you do stretches like this on a daily basis, I'm confident that you can keep plantar fasciitis away. You see, I'm stretching this back of the leg. Nice and easy, never forcing it, just nice and easy, and you'll see that slowly your heel will come down and get close to touching. Now, everybody has different mobility. If you have old injuries from soccer, football, baseball, what have you, or falls, it will be a little restricting, but don't force it. Just take it nice and easy. Now, from this position, if you can, come into a forward plank, engage your shoulders, and now slowly roll forward, look up, flip the feet. Now I'm stretching the flexors of the ankle and foot and going back into a full flexion of the feet, nice and flat if you can, and relax the pelvis. The pelvis should be fully relaxed. You can engage the mid-back muscles, stretch and try to pinch your shoulder blades together. Now, the buttocks, the glutes are in total relaxation. Come back up. Breathe in and out. You know, breathing is a very important part of relaxation. And if we don't breathe enough and take time to take deep breaths, your body and your mind will suffer. Now, as you can see, I'm dropping my pelvis down. They call this the cow position. And then we're going to take a deep breath in as you look up. And exhale as you come into what they call cat position, like a scared cat. I like to get a little silly from time to time. Deep breath in and out. And out. Now, if you can, just slowly go onto the ground. Take your time. And now, if you're able to, bring that hip up and let it go to the side. The ischial tubes, or let's just say the sits bones, the bones that when you're sitting there, part of your pelvis, see if you can align that so that it's nice and straight. Bring your foot forward, kind of like pointing your toes at your head. And as far as you can bring your knee, just do what you can. And just try to stand or sit nice and straight. Bring that leg into the inside of the thigh. And see if we can take a deep breath. And slowly fold forward. Again. Come up. And then exhale. You'll feel this in the hamstring. You'll feel this in the lower back. And it's a really great stretch to engage the bottom, engage the core of the hamstring and the glutes and the lower spine muscles of the pelvis. Now you can reach around and see if you can get your belly button to point a little bit closer to that foot. And out. As you do this, you're also stretching out the shoulder muscles. I won't get into the rotator cuff muscles, all the different muscles, but it really helps engage your sense of connecting yourself to your body. Because, you know, our day gets away from us. Even in the beginning of the day, we start going with all the things that we have to get done, and we many times forget about taking care of ourselves and how important that is. Now let's switch and let's do the other side. You can just switch and perform the same stretch on the other side. Remember to bring that foot forward. Sit nice and tall. Try to rotate that belly button towards the foot and take a deep breath in. Let the belly come out. And as you exhale, come forward. Come up a little bit as you inhale. And again. And again. Such a great stretch. Remember, you're really engaging the shoulder. You're stretching out the elbow. You're working your hand muscles. You're working your lower back. You're working the hamstring region, and you're flexing out the calf and the soleus and the gastroc, the muscles down here that are so important for our balance. Okay, we've done that stretch. Now, let's see if we can go ahead and bring your feet together and open up the hips. And everyone has a varying degree of hip flexibility. And if you are suffering from hip pain, do not force this move. Just take it nice and easy. The breath is so important. It truly is, because with the breath comes a sense of calm. Remember, our mind will dictate what our body can do. What you'll find is the more you do these stretches, the more open your hips will become. The groin muscles will begin to get stretched out. The knee feels yummy in this position. If you have osteoarthritic knees, perhaps you can't go as far. That's okay. Do what you can. Now, if you can, also, perhaps press down a little bit with your elbows, kind of driving your femur, your upper leg down. And sit straight as you do that and come forward. You can almost wrap around and pull. One more time. Okay, and now let's go over onto our backs, and we're going to stretch the low back. Now this is an exercise that I do before I really get out of bed. Each and every morning. Come down nice and slow. When I'm in bed, first things first, try to sleep on your back if you can. But when you're first waking up in the morning, I think it's important to bring our knees to our chest. And it's good to do one at a time first and open up that hip. And if you can do a stretch similar to this in the morning, you'll notice that when you get out of bed, how much more flexible and more connected you'll feel to your core, to your pelvis. When it comes to breathing, it's so important to realize that the diaphragm, which separates your abdominal cavity from your pulmonary region, has to lower down to really get the lung bases full of air. And the belly needs to come up. So a diaphragm breathing technique training is very simple, but it needs to be done because this will help you relax. Watch. You see the belly comes out first to drop the diaphragm so that it allows for more volume of air. And then the tops of your lungs should fill up at the end. Let's do that again. Slowly bring your knees up and see if you can grab your knees, perhaps maybe just the back of your legs, and bring it in. Again, deep breath. And then exhale. You'll want to repeat this a few times. But in the interest of time, I'm trying to keep this at 15 minutes. We're going to go slowly get up here. And let's get into a tabletop position, which is your knees underneath your hips and your hands underneath your shoulders. And let's go ahead and curl the toes underneath. And then we're going to reach out with one arm and see if you can balance and bring the leg all the way back. They call this pointer or bird dog. And I'm spreading my fingers in both hands so that I can really get the entire body to wake up. And you can take a deep breath in as you look up. And then exhale as you pull in. Notice how you really have to control your balance to maintain stability. This is a very great move. It really engages the core. We're going to go to the other side. Nice and easy. Let's finish off with cat and cow again. You notice how much more flexibility you have? Well, time's up. That's my notification that this was 15 and a half minutes. I hope you enjoyed it. See you next time.